Let's talk about the COVID response part of it, since that's what this all stems from. I mean, China isn't using the mRNA vaccines that much of the Western world is using. Their elderly population isn't fully inoculated. Why is China kind of sticking with almost an 18th century response to the pandemic when they've got 21st century tools available to them?
This is the golden question. There was a time when zero COVID made sense as a public health strategy to try to contain cases, to try to quarantine people, to prevent the virus from spreading. The sense is, among critics, is that the government has since squandered the time, that for the past 3 years, so much has gone into building this massive infrastructure to lock cities down, to take people away to quarantine. They're building these mass quarantine centers of shipping containers that are spread out in acres of fields. So there's the sense that all of the effort went into scaling up that aspect of controlling the virus, and the vaccinations part of it wasn't scaled up in the same way. There is a woefully low vaccination rate among the elderly and the vulnerable here, and as well, those foreign mRNA vaccines still haven't been approved here. So there is the sense that the government of Xi Jinping is now in a very tough position because they're having to quell the unrest that has been growing over several days and shows few signs of letting up, and also at the same time trying to not back away from this signature policy that they have held up as a success to this point.